Hi, my name is Nathan Rudemekin, and I'm a physician.
My name is Jesse Dovich. I'm also a physician, and right now we're going to talk to you about a solution for healthcare reform.
The solution to our healthcare dilemma, Jesse, is simple.
It is, Nate? Well, what is the problem with our healthcare?
The problem is healthcare costs too much. The reason is you, as the patient, do not directly control how much is spent on your doctor, hospital visits, and medicine.
Well, I don't understand what you mean.
Okay, let me simplify it with example. Say you bring your car in to get the brakes replaced at the mechanic, and he identifies several other problems with your car. What is your first question?
How much is this going to cost?
Exactly. So, how come when you go to the doctor you don't ask, how much is this going to cost?
Well, I never thought to ask that question.
Exactly. The reason is because you as the patient is insulated from the direct costs of your care through insurance, either government or public or private insurance.
Yeah, that's starting to make sense.
Okay, well, back to the car. After the mechanic tells you how much the costs are involved, what do?
Well, at that point, I prioritize. I decide to replace my brakes, I change my transmission fluid, and I don't do anything else.
Exactly. You would prioritize. Well, back to our current healthcare system. In this current plan, you can't prioritize because you're not in control of the money that's spent. It's a negotiation between your insurance company, either public or private, and your doctors, hospital, and the pharmaceutical companies.
Yeah, that's true.
And in the current healthcare reform bill that was passed in the House includes a public option. As you can see, it further insulates, adds another layer of insulation, and further isolates you from the cost of your care.
Yeah, good point.
And the bill in the Senate, which is debated, calls for an expansion of Medicare and Medicaid, which does the same thing. So, Jesse, another question. Why do you typically buy car insurance?
Well, Nate, I buy car insurance to protect me from unforeseen events.
Exactly, like accidents or theft. But for your routine maintenance on your car, like buying tires or brakes, you pay out of pocket.
Yeah, so I'm beginning to see. Basically, for my basic car maintenance, I pay those costs directly. Whereas for my catastrophic events, that's when my insurance steps in and helps cover the cost.
Exactly. What happens if we change the paradigm in healthcare?
Well, what do you mean by that?
Well, what if we use the same model where for your basic health maintenance you paid out of pocket and were in control of the cost there, and your insurance insulated you from catastrophic events?
That seems like it could make sense.
Yeah. So just to review, back to our original model, you'd see insurance would be pushed to the side, and you as the patient would directly be in control of the spending between you, the hospital, your doctor, and your pharmaceuticals or your medications.
Well, that seems like it could get expensive.
Yeah, you're right, Jesse. Health insurance is expensive, and currently either your employer or you is buying an expensive health insurance plan. But in the new model, you would buy low-cost catastrophic insurance with the remaining money being into a savings account that you could control and decide where the money is spent.
That'd be really great if that was all tax-free.
Well, it already exists in the form of a health savings account where you have catastrophic insurance and tax-free health savings account that you could draw from to pay for your day-to-day health maintenance.
Wow. But, I'm actually pretty happy with my current healthcare plan. Why should I change?
Well, back to the first point, Jesse. This graph by the Congressional Budget Office shows basically how our current spending in healthcare is unsustainable and rationing of care is inevitable. And if you're the member of a health maintenance organization or HMO, you've seen how your insurance company is restricting your access to care and also denying you procedures and medicines that your doctor is recommending. So, who do you want in charge of your health care? Do you want the government, your insurance companies, or you? The choice is yours. So, contact your senators this week and tell them that change in health care is necessary. However, you do not agree with an expansion of the current broken system. So call your senators and recommend they vote no
on H.R. 3962, Affordable Health Care for America Act.